Role of the social worker. You and your caregiver will be meeting with a social worker as part of your transplant evaluation. The social worker evaluates your ability to cope with stress and your ability to follow treatment plans. The social worker also helps you identify your caregivers, recovery needs, and insurance or financial responsibilities for your transplant. Transplant is a major surgery, and you are required to have 24-hour care for at least 3 to 4 weeks after you are discharged from the hospital. You will have several physical restrictions during your recovery, but you will not be bedbound. For instance, you cannot lift more than 10 pounds for at least the first month after your transplant. You will also likely feel tired, so it is important that you have caregivers to help you with your new medical regimen. Transplant is not something you can do alone. Caregiving after transplant. Your caregiver is typically a family member, such as your spouse, adult child, sibling, parent, or, in some cases, friends. You do not need a nurse. We highly recommend that you have at least 2 caregivers, a primary caregiver and at least 1 backup caregiver. Your caregiver will be helping you with household chores such as laundry, cleaning, and cooking. More importantly, your caregiver will be helping you with your new medications and possibly insulin. Your caregiver will also be helping you with checking and recording your daily blood pressures, blood sugars, temperatures, and urine output several times a day. It is also important to know that your primary caregiver will need to come with you to all doctor's appointments for at least the first month. Transportation. You will not be able to drive for 3 to 4 weeks after your transplant surgery. Please know that UCLA does not provide transportation. Post-transplant appointments. You will have 3 months of doctor's appointments after your transplant at UCLA. During the first month, you will be here 2 times per week. During the second month, you will be here once a week. And during the third month, you will be here once every other week. Your appointments start at 6 o'clock in the morning due to lab work. Please plan to be in the clinic for the entire morning. About 3 months after, you will return to your nephrologist for appointments and medication refills. Tips for employed caregivers. Please remember that you will need 24-hour care for at least 3 to 4 weeks. So, if your caregivers are working, they must take time off to assist you. Your social worker will review your caregiver's financial ability to take time off work to care for you. We will discuss benefits such as FMLA, vacation or sick time, and/or paid family leave. Your caregivers should communicate with their employers about the time needed to care for you. Financial preparation. There is a financial aspect of your transplant that you will need to plan for. Please plan for medical expenses such as insurance premiums, office copays, and medication copays. Another area that people often forget to plan for is gas, parking, and food expenses when you have your appointments. Please start saving money and/or fundraising for your transplant. Medicare. If you receive Medicare coverage due to kidney failure, this coverage will expire 3 years after your transplant unless you are 65 years old or older and/or if you have another disability that's acknowledged by Medicare. Back to the workforce. After your transplant, you may no longer be eligible for long-term Social Security disability, for example, SSI or SSDI. Social Security Administration will evaluate your eligibility for SSDI or SSI 1 year after your transplant. Your disability benefits can be canceled due to improved health. Please consider your options, such as returning to work or learning new skills. If you are working now. If you are working right now, you will need to take at least 3 months' time off of work to fully recover. Please speak to your employer or human resources about your time off benefits. If you would like to reach us, Please contact UCLA Kidney and Pancreas Transplant Program at our main office number 310-825-6836 or the donor information line at 866-672-5333. You may also find the following websites helpful: transplants.ucla.edu, unos.org, kidney.org, transplantliving.org, and srtr.org.